Good afternoon and welcome to Speak Your Mind. I'm Matthew Ngolovakandua, and with me in studio, I have the Lifeline team leader, Mr. Jeremaia Merekula, and later on we'll be joined by the research officer, Ana Baleveicau. Now, our topic for today is on suicide prevention and also World Suicide Prevention Day, with the theme Creating Hope Through Action. Now, Jerry, what exactly do they mean by this, or what exactly, or how exactly will your team create hope through action?
Naka Mbula, Naka Matthew, thank you for, first of all, thank you for having us today to be part of this Speak Your Mind session. This month, the month of September, which is next month, is Suicide Prevention Month. And for Lifeline, one of the things that we have been trying to do is focus on suicide prevention, and that is mainly why our crisis support line service is established to focus on the number of suicide and the crisis calls that comes in. So this year, the theme, I believe for the last 3 years, it has been working together to prevent suicide. This year, it has changed to
Creating hope through
creating hope through action, and I believe it is a suiting theme for this year as well, knowing the the pandemic that we are going through, and how this has influenced and impacted most of us, and having creating hope through action as a thing for this year, it speaks volume itself. In whatever small things that you do, wherever you are, in community level, village, national level, wherever you are as leaders, as a person, you have to be a person that creates hope for those around you.
Which kind of begs the question, what exactly has Lifeline Fiji been, or how have you been operating since April this year?
Thank you for that. Well, Lifeline Fiji has been hit hard as well during this second wave of COVID. One of the things that we have been doing is that we have been focusing mainly on our crisis support line. This year, a lot of our programs have been come on a pause, especially our corporate trainings and our outreach and awareness programs. But on that same note, we've tried to think outside of the box and try to be of help to Fijians that are going through crisis at this pandemic, and how can we support and look after them, knowing the COVID restrictions and that are in place. So for us at Lifeline, it's one of the things that are currently operating is in National Crisis Toll-Free Line. One of the other things that we have come up with was that the Sleeping with Bread project. These are small programs that we have come up with in, for the Street for Sleeping with Bread project. These are, working with our street dwellers and feeding them, also clothing them on a weekend. With that, we have also partnered with the Rotary Pacific Water for Life in trying to arrange food rations for families who have been reaching out towards the support line for help.
Now, just going back to what you spoke about in terms of difficulty in things like restrictions and being able to move, how has your team overcome that particular obstacle?
Thank you. For us, I believe the team consisted of 8 of us. When this pandemic came along, we struggled also in getting passes for the support lines after hours because of the curfew times. But we are thankful for influential people who have come along and pushed for that, and we managed to get a pass.
And who are some of these influential people, if you don't mind me asking?
For example, we have the Honorable Leonora Gerger Tambua, we have Selina Kurileda, we have Lionel Rogers, and other youth platforms who rallied behind having this, and then we were able to get these passes for our support officers to be working on shift hours during curfew hours as well.
And majority of your teams are on voluntary basis.
Yes.
So, with everything that's going on and everyone facing difficulties during the pandemic, how has your team overcome these difficulties, or how have they been coping?
Thank you for Matt. Well, for us at Lifeline, one of the things that we have is our support group within the organization. And one of the things that we try to make sure is have whenever we're going through things, whenever we are going through, we have a caller that comes in and we can't deliver or assist them well. One of the things that we do is that we have this group discussions, and we have a chat forum that we do this, and then we talk regularly. And also we have someone that we usually, who's an in-shift supervisor, who we, at the end of the day or at the end of the week, we always reach out to this person just for support sessions before going on to the next week. And I believe for us, we have two, and one would be speaking, on the third session, that is Anna, and we have another in-shift person that usually have us rallied around for support sessions. That is Zakia.
Okay. And just how many people are currently volunteering and working with Lifeline?
For our crisis support volunteers, we have currently 8 that are volunteering the line. We have volunteers who comes in on a weekly basis for our Sleeping with Bread program. But for manning the line, it's 8 of us who has been manning the line.
Now, I understand that there are different helplines that exist within the countries, right? Yours is the National Crisis Line. What makes you different from the other helplines that are available to people?
Thank you. Well, for Lifeline, just compared to the other helplines, I believe the others have their own different trainings and all.
I'm sorry, Jerry. Just we'll go to a quick break, but we'll definitely touch on that when we come back. You're listening to Speak Your Mind. Welcome back. You're listening to Speak Your Mind, and with me in studio, I have team leader Jeremaia Merekula, the team leader for Lifeline Fiji, and we were talking about the different lifelines, or rather the different call centers. Not call centers, sorry about that. The different helplines that exist within Fiji, and what exactly makes yours different from the others. You were touching on the trainings that you receive. So could you emphasize more on that, please?
Thank you, Matt. For Lifeline, we are specifically trained for crisis support service or crisis support, over the phone lines. And I believe for us, one of the things is that we are also trained with Lifeline Australia, who does a refresher training for most of our volunteers getting into the next year of being a crisis support worker. And also that we have to meet a certain deadline of how many hours we have to complete within a year. And, and I'm glad that we have, a very young team, energetic team. And also we have some, some of our senior volunteers who always come in and help. And, with us also, one of the things that we have is that we have a framework that we work around in supporting those who call into the line, and then the support framework is called the assist framework. So this framework is usually carried out. So whenever people call into the line, all of our support officers has to go through this framework and also identify a person that is suicidal ideation, suicidal ideation, and then work through with them into finding support nets that could help them overcome those suicidal thoughts that they have. So yes, I think one of the, if I may answer, one of the things that we have is that we have a framework that we work around with, and also one of the trainings that we have is that we are trained by Lifeline Australia, and we try to tailor make those trainings to fit our citizen or or the public that calls into the line.
Now, you spoke about the work that your team has been doing, and this is apart from the servicing the national crisis line. About the, what was it, I believe, the bread project or
Sleeping with bread.
sleeping bread project. Just how many people throughout? Was it just between the containment zones that you've helped out with this?
Yes, within the containment zone. So for the first week, we just concentrated for the Suva area, and then building up throughout the weeks. We thank the support and sponsors from our friends and families and followers of the work that we do. And over the week, we have increased, our project projection for, and then we started up until our last Sleeping with Bread project. We have covered from Nausori right up till Suva area. So we cover food and clothing for within the containment zone of Nausori to Suva.
And just to give the people an idea, especially for those who are listening in, just how much work goes into this for your volunteers?
Well, for the volunteers, it's a switch-on job. So it's a switch-on job, which means for us at Lifeline, one of the having the Sleeping with Bread project is like a stress reliever for most of the support workers, because most of them have been on the line trying to help others, and there was limited time. Because one of the things that you will hear on the third slot is that the increased number of calls that are coming in. So one of the things that we tried is try to organize something that our volunteers could also do, just to get their mind off, things that they're doing on a day-to-day basis, responding to calls and things like that. So, it's a full-on job, Matthew. The preparation starts on Thursday, Friday, Saturday, buying of the stuff, and Sunday it's a full-on day up until it's curfew time.
So for Sunday, what time would they normally be start preparing of the meals?
If the preparations of meals starts on Saturday, so they cut off all the foodstuffs, and then on Sundays just cooking, and then preparing for food deliveries. And one of the reasons we named the project Sleeping with Bread project is that a lot of times we can give a meal to a person in town, and then when we went and sit with them, we saw that a lot of them would wonder, if I eat now, what would I eat later? Or if he or she is eating in the evening, what would I eat in the morning? Okay. So they're always worried about what to eat
next meal,
what to have on the next meal. So that is why we've named the thing Sleeping with Bread project. Is that every time we go out, it's not just about feeling good or doing something about them, but just thinking of what could they have on the next meal as well. And that is why we didn't stop only with meal, but we also collect clothes to dress, to also clothe them.
And I have to say that is an amazing initiative that you've done. One of the things that I was interested in is in like with those that you've highlighted, especially with the different organizations, stakeholders. Are there any particular organization or government body that Lifeline Fiji would normally link up with, especially in terms of community outreach?
I think currently we have the National Suicide Committee of the Suicide Prevention and NCOPS, and that is one of the places that Lifeline link and work closely with the Ministry of Health, and the chair is the Minister of Health himself. And we also link up with other NGOs that are on the ground. One of the other NGOs that I would commend during this time is Psychiatric Survivors Association, who's been doing a tremendous job as well. Going through the going through the city and just looking after their members that are on the streets. I also would like to comment on Youth Champs for Mental Health, who have been doing a wonderful job online, and just reaching out for youths that are struggling. We also have the helplines that are available. Empower Pacific. 5626. If you're going through crisis, just call them. you have the child helpline, and the domestic violence helpline, and all these bodies, come together to help Fijians that are going through crisis.
Thank you for that, Jerry. We'll be back after the break. You're listening to Speak Your Mind. Gold FM, only the classic hits, 23 past 12. Matthew with you on Speak Your Mind. And with me in studio, I have Lifeline Research Officer, Miss Anna Baleveicau. Good afternoon, Anna, and thank you for joining us. We spoke about with Jerry, basically the in and outs of Lifeline and what you do and the national crisis line.
Right.
And one thing that I was interested in learning about was how many calls do you receive in a year?
Thank you.
Or at least last year. Sorry if you
Right.
don't mind me asking.
Thank you, Matthew. So last year, we have launched our new toll-free line, which is 1543. Made it easy for the nation, for the people to remember the number, right? So when we saw the number of people calling in, it came to 1,758 calls. So that's the call picked up on April. Was it April or May that happened with the first wave of COVID?
Yeah.
That's when people start to be aware what our services can provide with assistance.
And this is before the new number came into effect or after?
Before the new number have been launched.
Yeah.
It didn't pick up, but when it started to where on radio announcers been announcing our radio about the toll-free line, that's when our numbers start to pick up. And aware of it, we have managed to see what the nation is really searching for, and it's quite interesting. We're just happy that the numbers is picked up, even though we have to be concerned. But it shows that people are aware that their mental health is important.
Yeah, which
So,
is a great thing. And one of the things that you said, what's the number again? 1,700.
700.
That's
Yeah.
quite a big number. Now, how about from this year, from January to date?
Interesting. That's the best part, where we have found out that it picked up on the second wave.
Yeah.
From January to
The
just
date.
this date,
Yeah.
we have collected like 1,497. That's
Oh,
different,
yeah. That's
From last
almost,
year,
that's just 300 short of last year.
basically. It's quite serious, and to know that the numbers is picking up, but we have to be aware. We have to find ways where we have to encourage people to be resilient, where we have to let them know that there is organization that can provide support, that can provide services to help them through this crisis, especially from this pandemic.
What about the nature of the calls? What were they like before the pandemic?
Before the pandemic, people were more focused on, depression, anxiety, basically from family disputes, of, arguments.
And after the
cyberbullying.
pandemic?
After pandemic, new cases have come up with domestic violence have picked up, where food ration, now people are looking for assistance. And
So they're calling your service
Yes.
for food rations.
food ration. And, that is still a crisis,
Yeah.
where we have to stabilize them, to give them a way to show them solution, what they can do, where they can find help or the right organization to get food ration distribution.
Now, apart from the fact that Lifeline is located within this particular containment zone, do you have members working outside the containment zone, like within, let's say, the western area, the northern area?
Yes, we do. Lifeline, we have a certain group of people that we call them as like the extended families.
Yeah.
So whenever we know that there are people who have issues that are far away from our locations, from different divisions, we normally would let them know that there are toll-free lines that is provided if they need it. If they need a virtual face-to-face communication, that can be provided. But if they wanted like a home visit, that's where we have to make sure to see if they are okay to reach out and ask for help,
And
to help them.
one of the things that I had forgotten to ask Jerry was how many certified counselors are operating within Lifeline?
We have 3 certified counselors, and the others are basically certified also with a certain training that they receive from Australia Lifeline.
So they
Yeah.
they handle the crisis calls.
They help with the crisis calls.
So
Yeah.
whenever things become quite serious, they would refer them to the existing counselors.
Yes.
Okay. How would you classify the terms of, the calls that come in terms of threat level?
Right. When we are checking with people with the threat level on assisting them, so what we do is check on the guidelines to follow,
Yeah.
to evaluate the cases that meet the criteria of immediate assistance.
Okay.
Whether they need of suicide help, that's when we contact the police and to take us there.
Okay.
But then domestic violence, these is the main ones that we normally mark them as the main immediate assistance, where we make sure that they need this support. The child helpline, people with the child abuse cases, domestic violence, that we make sure that the Women Crisis Center are involved in it also.
Do you have like a rough number of exactly how many calls that have come in since the whole pandemic began last year? I mean, in total, or would you have this year in terms of domestic violence or child abuse?
For domestic violence and child abuse, we normally just stabilize them.
Yeah.
But then when meeting them to go to carry on with more help, then that's where we refer them to the right organization.
Okay.
So amount of calls that we will receive for domestic violence would come to like 100.
That's a big
150.
number.
Yeah. So it's just basically, even the crazy thing, but amazing also, is that men who are the perpetrators, they would call for help. They call in to need help in helping them to become better. So it shows there's hope, basically. So yeah.
That's something I never thought I'd hear, but which also brings up a question. Is there help for men like that?
There is. We just have to advertise it. We have to take it out there for the men to get help. Like, because mostly in our society, men have been stigmatized to silent their emotions, not to share about it. So there is a men talk where Lifeline do organize it. If people from communities would like that to be facilitated, then that's where we can always organize a men talk program for them.
That's quite interesting. And what procedures? Actually, we've covered that. But one thing that you highlighted with the domestic violence, the child abuse, in terms of child abuse, who do you refer them to?
We refer them to the child helpline within MSP.
Okay.
So their helpline is just so easy to remember. So their helpline is basically 1325.
Yeah.
Child helpline, and they work with MSP. So if parents see or relatives see that the child is in need or is not comfortable or is being, treated in a way it's not humane, like it's just not right, that's where we need to stand up and ask for help from the child helpline, where they can provide assistance, what can be done to help the child, to protect them, their safety, because their life is important.
Exactly.
Yeah.
Thank you for that, Anna. We'll take a quick break and then we'll be back. You're listening to Speak Your Mind. Good afternoon and welcome back to Speak Your Mind. With me in studio, I have the Lifeline Research Officer, Ms. Anna Baleveicau, and we were talking about the different, basically, the threat levels and what Lifeline does. What I'd love to know are more to do with stats. Last year, between the months of January to July, Fiji recorded 118 cases in relation to suicide. Now, this year, the same time frame, there has been 112 cases. Basically, in your professional opinion, do you consider the numbers to be high, and should we be concerned?
So, thank you, Matt, for that question. As we can see from January to July on 2020, it was 118. Yes, that was high. But this year, it showed a very hope, it reduced to 112. But still, we have to focus on helping these numbers. The difference between them, that from 118, the the total number of suicide cases from last year, is that the complete suicide and the attempt was just almost the same. It was quite the same number. But then it was like for suicide completion, it came to 61. And then for attempt, it came to 57. And then thinking about for this year, from January to July, the suicide reduced from 61 to 47. But the attempt is still high, 65. So as you can see, yes, we still have to be concerned because this is attempted. People are still looking for help. Where, imagine this is the people that are reported. There are some cases that is still not being recorded or being reported to the police, or even parents, families, or churches. They tend to tell police if they could probably just report it as like a normal death because of embarrassment of what they have done
and the whole stigma behind that.
Yes, the stigma.
Now, one thing that was quite interesting was to note, though, was the majority of these cases were in the Western Division. Now, this is a clear indication, of course, with what happened last year, borders being closed, people losing their livelihood. What are other reasons your team were able to identify as to why people were still struggling or why they were struggling?
What we have observed during that calls that we've received is that there's not a real proper organization to be helping them from the Western side or from different division. The Central side, we have all of it. We have the proper organization that can help people. And for them to come here, they can't because they are on the borders, like they are locked away. They need help and they need support. So what they do is they pile up with all their emotions. They get frustrated, angry, and they involve in so many issues. So I believe it's about, providing them the right proper facilities, the right organization that can give them hope or help.
So like an organization like Lifeline, with the National Crisis Line.
Because as you can see, there probably is some organization available from their division side, but probably they don't know about it. It's not properly, advertised. It's not told. It's not shared.
What about those within the Western Division? Given that Lifeline is easy to access through the phone, how many of them access the services that you can identify that came from the Western Division?
Yes. The highest calls that we receive mostly are from the Central. So that shows that our focus has already been
just
alert
within
from the Central Division. From the Western, it's not so much. But then we could see from the stats that they have the high case level, right? So they still need they need the light to be shine on them. They still need the
more
right organization. Yes.
Okay, so are there any existing mental health services that exist within the Western Division?
Yes. There is Empower Pacific that can provide services and assistance. There are other counselors that works individually that we can always contact them as long as they find the right referral pathway where they can contact Lifeline and we can refer them to those organizations, that numbers. So that's what we can do to provide the services for them.
Clearly, the referral pathways, there might be a breakdown or it might not be working properly. What would you say needs to be done with existing mental health services working alongside, let's say, with government to improve this sort of referral pathways and getting help to the people in the Western Division?
Yeah.
What are some of the things that you could think of that that might be able to help with this, with the rise in numbers in the Western Division?
Yeah, that's the thing. I believe it would be better if the organization or stakeholders or even the government could be aware of that there's a high case from the Western side. So if they could reach out to the organization within MSP or Empower or even with the mental health hub, I've heard that they can provide assistance with people with mental health cases so that they can provide transportation and take forward. So we just need more focus for people to know what mental health, that it really matters.
Yeah. One of the things that I also noticed during the stats were that the numbers were high between the ages of 18 and 31.
Yes.
Why is that?
That's the thing with youths.
Yeah.
Youth these days are facing crisis issues that are not even sharing about it. They tend to either project it in different ways. They tend to think that it'll burden their family. So I believe the support system is missing from that part of life where people are being misunderstood, being interpreted in a different way just because of something that they did, something that they have behaved in a manner. So it's just about miscommunication with what they're trying to do. So what we have to do and focus is on trying to understand them. Mostly when we communicate with people now, is just to respond back rather than to communicate and understand. And that's what the youth are facing. We lack to understand what they are going through.
And another thing that I could not believe was that during the months of January to July this year, the numbers were higher amongst men than there were women. In fact,
Yes.
3 times higher.
3 times higher.
In fact, 36 men died as a result of suicide, whereas 11 women were recorded. Not to say that those 11 women, their lives didn't matter, but why exactly is the number higher amongst men than women? You highlighted the point where, men need to talk more about their feelings.
Yeah.
What is the reason behind men not being able to express themselves more?
It's about culture. It's about how we were raised.
Yeah.
Men were raised that they're not supposed to show their emotion because if they do, they're known for being weak. If they talk about it, it shows that they can take care of their family. It shows in a way like it spoils their ego. It makes them feel like helpless. So why they just tend to be quiet about it. And when they're quiet about it, it piles up. And when it piles up, the action is different. That controls their mind, that controls their emotion, everything when it goes out of control. So as you can see, man is high, but the thing is, the difference is that
women talk more about their feelings than men do?
Yes, they do. They tend to vent out, which is good.
Yeah.
They vent out their stress. You don't want to keep it inside. But for men, it's so hard for them to vent out because they feel like they've been judged.
Yeah.
So that's the reason about it. But the mostly people that have been affected from the men is the Fijian Indian descendants. They are from the high case of it. And then the second of it is the Itauke.
Yeah.
So that shows that from culture, where the Indian descendants have been encouraged that not to show weakness by expressing their emotion, that they have to be strong. So it's a stigma.
Yeah.
It's been carried out.
Thank you for that, Anna. We'll just go to a quick break and we'll be back. You're listening to Speak Your Mind. Goldie Family, the classic hits. You're listening to Speak Your Mind. And with me in studio, I have the team lead again, Mr. Jeremaia Merekula, who is part of Lifeline Fiji, by the way. And we're talking about suicide prevention and World Suicide Prevention Day. Now, just going back to what Anna and I had spoken about, especially in terms of culture and how that affects men and men not being able to express themselves. One of the things that she also highlighted was men's talk that Lifeline Fiji caters for. How often do you do that?
Thank you for that, Matt. Well, for the men's talk program, just recently we have started off with the support groups, virtual support groups. So these are, if there are people that needs the support groups to, to talk about whatever they go through, we just want to encourage that no one is going through anything alone, and everyone is going through something during this pandemic. So we encourage people to, register in those support groups, and that is facilitated on a weekly basis. For the men's talk program, that is something that we also do, when men reach out for help. And we also do a men's talk program, amounting to the number of registrations that comes in. And we do a support sessions for this men's talk program. So it can be a once in a fortnight, but it's once in a fortnight. If it goes on, then it's one in a month.
Do you think that other entities should be involved, like, let's say, I don't know, faith-based organizations should be involved in something like this, linking up with your services in terms of getting men to talk more?
Yeah.
Given that more men sort of rely on religion and faith to guide them.
Thank you, Matt. That is a really good question. When we talk about the highest number of suicide, not only in Fiji but in the world, men's has always been dominating the number of suicide. In Fiji alone, we have every 36 hours. Even now, someone could be contemplating suicide. So every 36 hours, someone contemplates to complete suicide. And we over the years we have 105 average number of suicide cases in Fiji, and that is a lot of number. And mostly these numbers are dominated by males. And Anna and you mentioned earlier on, is that it goes back to our upbringing, who we are. And as a male, we are confined of to that we have to be strong. We don't have to show emotions. We have to be we have to be the head of the family and showing all these brave faces. But one of the things that we encourage during this Men Talk program, God gifted. I always learn, this is something that I learned from someone. God gifted you two holes on your eyelids that whenever you have these feelings, water drop down.
Okay.
And that is called tears. And then why does God created us in a way that it is okay to show emotions. It is okay just to be you. It is okay just to go through things emotionally. And that is why at Lifeline, one of the things that we try to talk about is when we're talking about mental health, we're also trying to talk about emotional health and not internalizing the pain that you go through externally. And and that is why a lot of our suicide cases have been rising, because people are starting to internalize the pain that they go through, and they think that they are worthless. They think that they are not good for anything, and they have stigma around this.
And how can families and communities do more to at least try and prevent the number of suicide cases? What do you think should be done more?
This is where the theme also comes in, creating hope through action. For families out there that are listening, all these people that are going through, their small storms and their small everything, all they need is a listening ear. They need someone to listen to them.
And how is your team planning on creating awareness for this year for World Suicide Prevention Day?
So for everyone that is listening to today on this broadcast, Lifeline Fiji is hosting a virtual vigil session. It's on the 10th of September, which is World Suicide Prevention Day. You can join in onto our Lifeline page on Facebook, and you can also register yourself to be part of that Zoom call. We have motivational speakers that are lined up, and we have also survivor stories that are lined up as well for the night. And get a candle and let's light a candle for someone that we love.
That's amazing. And they can go to your different platforms. You have Facebook and Instagram as well?
Yeah.
Okay, so what if anyone wanted to help support Lifeline and the work that you do? How can they go about it? Is there a way they can get in touch with you or donate money to your bank account?
Naka, yeah, Lifeline has a if anyone wants to help, Lifeline has a bank account that everyone can reach out to, and they also just send us a message or call us, and then we can send over our bank details. I believe the team will put on our bank details on the video that is coming out. So please, if you need to help someone, or if you need to help Fijians that are going through crisis and support a support officer that is on the line, please donate on that account number that is shown on your TV screen.
And what sort of message would you like to leave anyone listening in today?
The message that I would leave everyone is that in whatever small ways that you can help someone that is struggling or going through any sorts of crisis, I'll go back to the theme of this year, creating hope. Create hope for that person and be a lifeline to that person and hear them out. If you have This is what we always say. If you have loved ones that are struggling and you haven't been in contact with them for so long, and you think this is the time that we mend our ways and check in on them, tell them how much they meant to you. You can call your mother, your dad, your sisters, your brothers, anyone that is close to you. Let them know how much you care for them.
And the number to call Lifeline again if anyone needs help?
The number they can call is 3300446 or 3300447. If you're in crisis and you need to talk to a support officer, the number is 1543. And if you're clicking that on your mobile phone, it's simply One Life.
Thank you, Jerry, and to the Lifeline team for coming in today for Speak Your Mind and sharing the amazing work that you're doing. The community owes you and the nation a very basically great gratitude, a great honor and service that you're doing for the people of Fiji. You're listening to Speak Your Mind, and that's it for the show. Remember, the number that you can contact for Lifeline Fiji if you are in a crisis is 1543. You're listening to Speak Your Mind.